Hey, I'm Dr. Alara Hayes, and today we're going to go through some of the most important questions women have about their bodies. I want you to take a breath before we begin, because if periods have ever made you feel confused, embarrassed, exhausted, or quietly scared, you are in the right place. So many women spend years wondering if what they feel is normal. You may have been told to tough it out, to stop being dramatic, to expect pain, to accept heavy bleeding, to laugh off the stomach issues, and to treat your own body like an inconvenience. But when you are the one doubled over in a bathroom, changing clothes in the middle of the day, missing school, missing work, or lying awake at night worried that something is wrong, it does not feel small. It feels personal, it feels isolating, and sometimes it feels like no one is saying the quiet part out loud, which is that you should not have to suffer in silence just because the suffering is common. I have sat with teenage patients in the hospital who were trembling with fear because they thought the amount of blood they saw meant something terrible was happening. I have cared for women in their 30s and 40s who had structured their entire month around where the nearest bathroom was and whether they had backup clothes in the car. I have listened to women whisper about diarrhea during their period like it was some shameful secret, and I have seen the relief on their faces when I told them gently that yes, it is real, and no, they are not strange. So I want this conversation to feel like a hand on your shoulder and a light being switched on at the same time. I want you to feel comforted, but I also want you to feel informed, because the more clearly you understand what your body is doing, the less power fear has over you. One of the biggest questions women ask is how much bleeding is too much. Medicine has an older technical definition of heavy menstrual bleeding that refers to losing more than about 80 milliliters of blood during a period. But let me be honest with you, most women are not measuring that, and that number alone does not capture what your real life feels like. What matters is whether your bleeding is taking over your day, your energy, your confidence, and your freedom. If you are changing a pad or tampon every 1 to 3 hours, if you are soaking through products and having to double up, if you are wearing a tampon and a pad together because you do not trust your period not to break through, if you are avoiding errands, meetings, travel, exercise, sleep, or intimacy because the bleeding is too hard to manage, then yes, that is important. In clinic, when a woman tells me, I plan my life around my period because I cannot risk being away from a bathroom, I do not hear inconvenience. I hear a medical issue that deserves respect. The most important truth I want you to hold on to is this. If your bleeding is interfering with your life, then it matters. It matters even if someone else says their periods are heavy too. It matters even if you have been dealing with it for years. It matters even if you have learned to function through it. Heavy periods can contribute to anemia, fatigue, dizziness, and a constant low-level fear that slowly shrinks your world. They can also be related to things like fibroids, hormone changes, bleeding disorders, or other gynecologic conditions, which is why they deserve proper evaluation. And even when there is nothing dangerous behind the bleeding, you still deserve help. There are treatment options. Birth control can be one option for some women, but it is not the only one. In some situations, medications such as ibuprofen can actually help reduce menstrual blood loss, although the right dose and whether it is safe for you depends on your own medical history, which is why that conversation should happen with your doctor. There are prescription options too. The point is that you are not supposed to simply endure it and call that normal. Then there are cramps, and this is where so many women begin to question themselves because pain is invisible. Other people cannot see the ache twisting through your lower abdomen. They do not feel the pressure in your pelvis, the nausea, the back pain, the exhaustion that follows wave after wave of cramping. They only see whether you showed up. They only see whether you kept smiling. So let me explain clearly what is happening. The lining of your uterus produces substances called prostaglandins. Those prostaglandins help the uterus contract so that the lining can separate and leave the body during your period. Your uterus is a muscle. And when a muscle contracts, it can hurt. Those contractions can also temporarily decrease blood flow and oxygen to the uterine muscle, and that lack of oxygen contributes to the pain. So if you have ever wondered whether cramps are real in the full physical sense they are, there is a true biological reason behind them. Sometimes cramps can also happen when blood collects in the uterus and forms a clot, and then the cervix has to open enough to let that clot pass. That process can be painful too. And one reason cramps may be much worse for you than for someone else is likely because bodies make different amounts of prostaglandins. One woman may have a period that feels like mild discomfort, and another may feel like her entire body is bracing against pain for 2 days straight. That difference does not mean you are weak. It means bodies are different. But here is where I need to speak plainly. If your cramps are so severe that you are vomiting, fainting, missing school, missing work, unable to stand upright, unable to think clearly, or needing very strong pain medicine just to get through the day, that is not something to dismiss. It does not automatically mean something catastrophic is happening, but it does mean you should be evaluated. I have cared for patients who were told for years that painful periods were simply part of being a woman, and then later we discovered problems like endometriosis, adenomyosis, fibroids, or other conditions that deserved attention much earlier. I have also cared for women whose testing did not reveal a dangerous cause, but their pain was still severe enough to deserve real treatment. You should not be debilitated by your cycle. That sentence matters. You should not be debilitated by your cycle. Another question that creates a lot of fear is blood clots during a period. You stand up, you feel a sudden rush, you look down, and what you see can be startling. It may be dark, thick, jelly-like, and very different from the bright red blood people imagine when they think of bleeding. Most of the time, clots by themselves are not a sign of something terrible. Often the blood has simply pooled in the vagina, and because your body is designed to clot, it coagulates before it comes out. Then when you change position, walk, or sit on the toilet, it passes all at once. I cannot tell you how many times women have come into my office frightened by this, and how often the explanation is much less alarming than they feared. Menstrual blood does not always look neat. It can be dark red, bright red, brownish, mixed with tissue, and sometimes clotted. That said, context matters. If you are passing very large clots, or if the clots are happening alongside extremely heavy bleeding, severe pain, dizziness, weakness, shortness of breath, or a sudden change from what is normal for you, then that deserves medical attention. Your body has patterns, and when those patterns change dramatically, it is reasonable to ask why. You are not overreacting by getting checked. Once women understand what cramps are, the next question is almost always how to make them better, because knowledge helps, but relief matters too. Heat is one of the simplest and most effective non-medication options we have. A heating pad, a hot water bottle, or a warm compress on the lower abdomen can make a real difference. In the hospital and in clinic, I have watched women relax visibly within minutes of warmth reaching the muscles that have been clenched all day. Exercise can help some women too, though this is very individual. Some women tell me that gentle movement, walking, or stretching reduces their cramps significantly. Others feel no change, and a few feel worse. So if exercise helps you, that is wonderful. And if it does not, that does not mean you are doing anything wrong. Acupuncture can be a useful complementary option for some women with painful periods, and a TENS unit, which delivers mild electrical stimulation through the skin, has also helped many patients manage cramping. These options are not cures, but they can be part of a meaningful plan. When it comes to supplements and herbal remedies, I want to be careful with you. I know the idea of something natural can feel safer and more appealing, especially if you are tired of medications. But many supplements marketed for period pain do not have strong enough evidence or safety data for me to recommend them confidently. Some may help, some may do very little, some may interact with other medications or create risks people do not expect. Natural does not always mean safe, and marketing is not the same as science. As for medications, non-steroidal anti-inflammatory drugs like ibuprofen and naproxen are often among the most effective first-line treatments for menstrual cramps because they reduce prostaglandin production. That means they are working on part of the cause of the pain, not just dulling the sensation. In general, they tend to work better for cramps than acetaminophen alone. There are also over-the-counter products marketed specifically for periods, and while they may help some women, many of them are combinations of acetaminophen, caffeine, and antihistamine or diuretic-type ingredients rather than targeted anti-inflammatory treatment. The right choice depends on your medical history and what your body tolerates, which is why personalized guidance matters. I also want you to know how to recognize when period pain has crossed the line from common to unacceptable. If you are already using over-the-counter medication, heat rest, or other low-risk measures, and you are still unable to function the way you want to, that is not something to minimize. If you feel like your doctor is not fully hearing how severe your pain is, be direct. Say, "This is interfering with my ability to live my life." Those words matter because they make clear that this is not just discomfort. This is loss. Loss of time, energy, focus, and freedom. And if someone dismisses that, it is okay to seek another doctor. You deserve a clinician who listens carefully and gives you options. Now I want to talk about one of the most common things women experience and one of the least discussed: period poops. Yes, they are real. Yes, they can happen right before your period starts or during it. And yes, there is a reason. Remember those prostaglandins we talked about earlier, the substances that help your uterus contract? They do not only affect the uterus, they can also act on the gut, which is why some women notice looser stools, more frequent bowel movements, or even diarrhea around the start of their cycle. I have had patients look at me with pure disbelief when I explain this, and then immediate relief because something they thought was random or embarrassing suddenly makes sense. Not every woman experiences it, and some barely notice it at all, but if it happens to you, you are not imagining it. Sometimes the hardest part is not the symptom itself, but the moment you start wondering whether you are allowed to call it a problem. I have had patients sit across from me and say, maybe I'm just bad at handling pain, or maybe this is what being a woman is supposed to feel like. And that is where my heart always aches, because too many women have been taught to measure the seriousness of their suffering by whether someone else believes it. But your body does not need permission from anyone else to deserve care. If you are afraid every month, if you are counting hours until the bleeding slows down, if you are planning your clothes, your meals, your travel, and your sleep around symptoms that leave you feeling trapped, that emotional burden is part of the medical picture too. Your cycle affects your mind, your confidence, your relationships, and your sense of safety in your own body in ways people rarely acknowledge or understand. What breaks my heart is how often women carry all of this alone. The heavy bleeding, the cramps that make them curl forward and breathe through the pain, the clots that spark panic, the bathroom symptoms that feel too embarrassing to mention, the private fear that maybe everyone else is coping better. You may have spent years minimizing your symptoms because they happen every month, because other people around you act like periods are supposed to be miserable, or because you were never given language that made your experience feel medically valid. But common does not always mean normal, and normal does not always mean acceptable. So I want to leave you with this. Your body is not asking you to be ashamed of it. Your body is asking you to listen. If your period is too heavy, if your cramps are too intense, if the clots scare you, if the bowel changes catch you off guard, if any part of your cycle is interfering with your ability to live your life, you deserve answers. You deserve treatment. You deserve to be taken seriously. And if no one has told you that with enough warmth and certainty, let me tell you now. You are not dramatic, you are not weak, and you are not alone. There is nothing silly about wanting your life back from your period. There is nothing excessive about asking for help. The more you understand your body, the less trapped you become inside fear, and the more powerfully you can advocate for the care you deserve. I want you to walk away from this feeling calmer, clearer, and stronger. I want you to know that women's health is not a small issue. It is your daily life, your dignity, your energy, and your peace, and you matter far too much to keep suffering in silence. What your period has been trying to tell you: